Coronavirus has changed the lives of everyone in the United States. Millions of cases and thousands of deaths. Now, after months of waiting, the COVID-19 vaccine is finally here.
Hopefully it's going to work.
The demand is so high and the supply is so low.
But with the vaccine comes questions.
When would the vaccine be available to the general public?
If the vaccine is covered under insurance.
The side effects.
What are the long-term effects?
The timeline.
How it rapidly came about.
And the future of the pandemic.
What it kind of looks like here in a year.
Live, South Carolina, COVID vaccine. Your questions answered.
Good evening. Welcome to this statewide special answering your questions about the COVID-19 vaccine. I'm Amy Wood in Greenville.
And I'm Gordon Dill in Spartanburg tonight. Throughout the hour, we'll be joined by our colleagues Carolyn Murray in Charleston and from Myrtle Beach, Megan Miller. We're taking your questions to the experts tonight.
Of course, at the center of our state response is the Department of Health and Environmental Control, and we are joined this evening by the Interim Director of Public Health for DHEC. That's Dr. Brandon Traxler. Dr. Traxler, thank you for making time for us as we start off with the rollout in South Carolina. There's a study out this week ranking us in South Carolina 10th in the nation for putting shots in arms, but the CDC placed us dead last for the number of shots per person. So why so few shots? Okay, I guess we're not able to hear Dr. Traxler at the moment. We're working out those little bugs in the system, but we have had a number of viewers giving us questions about the COVID situation across South Carolina when it comes to this vaccine rollout. We're going to be bringing your questions to the experts throughout this hour and getting answers to them as quickly as we possibly can on a variety of issues. But let's try one more time, Dr. Traxler. I know you could hear me, but we could not hear you. Why so few shots in South Carolina?
So South Carolina has received a normal amount of shots per capita for our population. They are using the same formula for everyone in every state to allocate vaccines from the federal government. However, South Carolina, unlike many states, really wanted to be certain that we had all the doses needed to vaccinate those most vulnerable people among us, those residents and staff in the nursing homes and assisted livings. We allocated all the doses that were needed for that program for long-term care facilities to that federal pharmacy program right up front. That has meant that they have been shipping into the state on a slower weekly basis as the pharmacies have used them in these facilities. However, it means we are not having to continue to allocate doses out of what's coming into the state every week towards that program the way a lot of states are.
Well, many
so
states,
we are, it is going to even out in the end. Mm-hmm. But right now, we have guaranteed that those most vulnerable will have the shots that they need. And we are still getting shots, our fair amount, in to the state and getting them in people's arms.
You know, we've got, though, the statistics are out there. We are one of 11 states in the nation that still is in phase 1A. Most other states in the country are in 1B already. So something is different here. How do you explain it?
Well, so we have included the population of 70 and older in 1A. Many states have left them in 1B, and the ages that are being used are a variety of ages depending on that cutoff in other states. But in South Carolina, we moved the 70 and up over into 1A, and so that is where we have the population now.
Well, we have questions from all over the state and the region. We want to talk a little bit about the first couple from Spartanburg and Gaffney.
My number one question and concern is long-term effects of this vaccine.
I just want to know if there are any side effects of this vaccine.
What are the long-term effects?
I'd like to know if there was any side effects to the vaccine. That'd be important to know, if there's anything that you can expect.
So, Dr. Traxler, what about those long-term impacts?
Certainly. So they are still gathering information about some of the long-term effects of these vaccines, including how long they work for. But they have proven in their studies to be extremely safe. And they have required at least a couple of months of follow-up for all of them, for every single participant in phase 3. And we're continuing to gather data, and all adverse reactions or problems that could even potentially be related to the vaccine are required to be reported to the CDC. I am not aware of any significant side effect or adverse reaction.
Another quick question now from Greenville from one of our viewers.
I would like to know how it affects people that are going through cancer treatment and people like with immune deficiencies and stuff like that.
And that question,
sure.
Doctor?
So, yeah, we are still needing some more data on people with weakened immune systems to know the safety and the efficacy, how effective these vaccines are in those people. So I recommend people talk to their regular doctors and ask whether they're a good candidate if they're going through one of those treatments.
Dr. Brandon Traxler, great advice. Thank you. And we appreciate you joining us. Stay with us. COVID vaccine, your questions answered. We are coming right back with more.